Minister, distinguished guests, ladies and gentlemen, good morning to you. It gives me great pleasure to introduce our next plenary session and our speaker. And in continuing with the theme of data and technology, the next talk is on digital transformation in health. We know that innovations is changing the way care is being delivered in markets around the world, and information silos are being opened. In fact, care delivery is moving from within walls to outside of walls with the removal of barriers. Rapid advances in data science, machine learning, and cognitive computing is going to challenge the way we think about the business of healthcare. And to talk about this today, I'd like to call upon Mr. Gabe Rijpma, who is the Senior Director of Health and Social Services for Microsoft with a regional office based in Singapore. Mr. Rijpma's responsibilities include leading solutions and strategies for meeting the needs of healthcare customers across Asia-Pacific region, including not just China, Japan, Asia, but also Australia and New Zealand. Mr. Rijpma, the stage is yours.
All right. Thank you very much. Absolutely amazing to be back in Ho Chi Minh after 4 years away. I just can't believe the amount of change and progress and advances that are happening right here. And no matter where I go in Asia, the level of innovation that's happening and the level of focus on disrupting and changing the way we do things is just paramount. Today I wanted really to talk to you about what's happening in the digital transformation of healthcare. Technology is all around us. It's changing the way we live, it's disrupting entire industries, and it's dramatically changing the way we think about how to apply a lot of different technologies in the way we do our work and the way we live our lives. You hear about the Internet of Things, you hear about machine learning and advances in data science, and every industry around the world is looking at how to use those technologies to make a significant difference in the way that they drive their business. And healthcare is doing exactly the same thing. And so it's an incredibly exciting time for both society and technology and how we are bringing those together to drive advances in healthcare. When we think about the advances that are happening, there's some pretty amazing statistics out there. By 2020, there'll be 1 million new devices added in the world every single hour. These are not phones or more computers, but these are things like sensors and intelligent buildings and everything that is going to be connected. An amazing change that is going to enable new advances to occur that we've only ever dreamed of. Over the next 12 years will be the average age of an S&P 500 corporation. Whole industries are being disestablished, and we've seen that with photography, we've seen that with the taxi industry, and it's going to happen to healthcare as well. And the businesses that we think are big today are not necessarily going to be the businesses that are big tomorrow. And so that rapid change really challenges each and every one of us in healthcare to think about what kind of care model do we want to build and how do we use technology to make that happen. And the last interesting statistic is that 60% of computing will be in the public cloud by 2025. No longer in our data centers, no longer in our hospitals, but we'll use massive cloud-scale elastic compute in the public cloud to make that happen. When we think about applying that to a healthcare context, there's an amazing set of changes that are going to occur as well. And it's really driven by the consumer and the expectation they have of healthcare services. If I'm honest about how are we doing in healthcare today, I don't think we're doing that well yet. And I'm going to show you some great innovation of what's going on. And I think many people have dreams and visions about getting there. But if we compare ourselves and are really honest with ourselves, comparing ourselves to other industries, do you think we get an A+ or maybe a B-? And my view is that we're still a B minus, but we're all hoping and aiming to be that A plus and to be the people that build those consumer experiences in healthcare that we can all be proud of. We know that all of us in this room share a broad set of health industry challenges, whether it's more people, more chronic diseases, less budget, and more complex cases that we have to deal with, and on a technology standpoint, are dealing with a barrage of cybersecurity events, compliance and regulatory things, data and systems that don't talk to each other, and a lot of medical advances coming on board that we're not always ready to be able to consume. But it's an amazing time to be able to address those challenges head on and drive the aspirations for us to move from a system of sick care, which is what we've traditionally done, to a model that is very focused on, I think, what we all want to be in this room, a model that drives prevention and focuses on population wellness and really uses technology to support the lives of our people so that we don't have the ambulance at the bottom of the cliff, but we really put the ambulance at the top of the cliff and really help and drive a supportive environment. That requires every single one of us to think differently about how we do our healthcare business, how we run our hospitals, how we run our clinics, how we run our aged care homes. It requires us to think differently about how we apply technology to challenge the business processes that we've believed in over 100 years. So we believe that for hospitals and healthcare systems to really empower health transformation, there are 4 key things. The first is engaging your patients, and that's what I'm going to talk about more today. The second is empowering your care teams. The third is using data analytics and insights to be far more insightful about the data that you have, and really what we want to be able to do is fight death with data. And the last is about using advances in the Internet of Things, sensors and all that stuff, and bringing that together to really deliver a transformation in the whole care continuum, from the hospital to the home, and from the home to the clinic, and the home to the aged care center, and have that integrated value chain and ecosystem delivered in healthcare. If you're a patient, the patient journey that we expect them to take is incredibly overwhelming. These are just a few simple steps that one patient might have to go through and coordinate as they go through our system. It's upon each and every one of us to simplify that and remove the complexity of many of those steps and automate those tasks so that the patient can feel comfortable in that journey and the interactions they have with that healthcare system. And so, if we want to improve that patient journey, we really need to focus on 3 things. We need to provide much more efficient access, and efficient access doesn't always mean we have to go to the hospital or the clinic to get that service. We want much more efficient engagement and connections between these things, and we want much more continuous engagement. It's no longer okay just to discharge a patient from a hospital and say, great, that's job well done. We need to think about that continuum of care. And so I'm going to show you some examples and how this comes together. The first is more efficient access. So have a think about ways that we can do automated ways to find the right doctor, automate the scheduling of appointments, centralize the record keeping so that we don't have data spread across hundreds of source systems, which forces us to ask the patients time and time again for the same data, and ensure that we automate processes for determining staffing needs and use data and insights to drive that innovation. One organization that I'm incredibly proud of is Operation Smile. And I'll play the video so you can see what they do, but they coordinate surgeries all around the world. They have to coordinate doctors, facilities, operating theaters, a number of things, and they're really transforming their business, changing the use of technology to make that happen. Let's have a look.
Operation Smile is an international NGO that seeks to take care of children with facial deformities in the most underserved regions of the world. A program of Operation Smile, it used to take months or even a year to put together because you have to look at every detail. Mobility plays a truly crucial role. If we're operating 21,000 children a year, that means that we have 3 missions starting sort of at any given moment.
Whether that's keeping track of organization on the recruitment end, there's a huge amount of logistics to take all those patients and put them through 20 or so steps before surgery and to keep track of that and make sure everything's done with safety and quality and nothing's missed.
The children who come to us, we might be the only chance they have. So that creates an overwhelming sense of responsibility. With Microsoft Office 365, I'm able to touch base with clinicians all over the world. And not only clinicians, but all the people who are involved in putting together a mission.
It's greatly enhanced this planning process so that when everyone is on the ground, it will be a well-executed mission.
OneDrive for Business has allowed us to consolidate all these sort of rogue projects we had going on, Box.com, Dropbox. We had some FTP servers, SSFTP servers. We're aggregating all that together into OneDrive for Business. It's easy, it's consistent, we have plenty of space for people to use, and then we can control it.
We use OneDrive for Business to really comprehensively manage many of our documents, whether that's an Excel spreadsheet that we're keeping updated to organize our 40 research projects or our business plan for the next 12 months. We use photos all the time as well as part of everything that we do in plastic surgery. So OneDrive for Business gives us a place to put all of that.
We are now looking at really innovative growth in programming and scaling up what we're able to do and how many children we're able to take care of each year. So I think the future is wide open for us.
The Microsoft platform makes us more efficient. We're a global charity, but we've got to run our charities as efficiently as possible to provide as many smiles as possible with the top quality that is available. We can literally connect the best of medicine to the most needy of patients in real time. And that's been a dream for a long time, and now we see it happening before our eyes.
Operation Smile's impact goes well beyond the 21,000 children that we're operating at this point. It's just the beginning of the impact that we hope to have in the future with the tools at our disposal.
I love what Operation Smile does because they touch the lives of 21,000 patients today, and they do this all over the world. But it's technology that's helping them drive that coordination, which ultimately will enable them to see more patients and operate on more patients with specific needs in underserved communities. And that, to me, is really what it's about. Sorry, I'll just go back. So the second thing is around more efficient engagement. And what I was going to do is I was going to show you a video from Max Healthcare in India, but just in the interest of time, I'm going to just pull it out. But Max Healthcare in India is doing some really amazing work around bringing the community and the care clinics into the community itself and using and driving patient engagement solutions driven around CRM to both integrate online booked appointments, physical appointments that come in, and really coordinate care far more effectively around that. And what I'll do is I'll make that link available to that video from Max Healthcare in India to all of you in the show later today. The third is really around more continuous engagement. So one of the things that we want to do is provide a continuum of care in healthcare that's often been very, very difficult to do. This really means extending care right into the home and having that relationships with the people, with the parents of loved ones or children, and really engaging that in a very emotive way and building that relationship with people where they are. In order to do this, we need to do things like continue the communication between visits and have that very well integrated. We need to ensure that we engage inside and outside the care setting. We need to turn curated patient information into wellness plans, and wellness plans that patients buy into and are involved in and really drive to make a difference. And last but not least, ensure that we facilitate follow-up care via take-home devices and so forth that ensure that we can continue to have telemetry in the home to make that happen. I love the story from Children's Mercy in Kansas City, and I think it tells the story very well itself, and so I'm just going to play that for you.
I think in the back of each of our minds, we were planning a little funeral. And just didn't know where it would go after he was born. Winston was diagnosed with HLHS, which is hypoplastic left heart syndrome.
1 in 100 to about 125 babies are born with heart disease every year. And out of those, about 1% are born with half a heart. Out of all the heart surgery we do, this is the most high risk.
They lose about 25% of these babies in between the two surgeries.
The standard of care at the time was to send these families home with a weighing scale and a pulse oximeter and a 3-ring binder, and they were asked to record measurements of their baby every day.
There would have been a lot to juggle and learn on our end, just as new parents. And then we added all these things in that really increased the stress level.
So we needed a method that we could actually send something home with the parents so that we could better monitor and be alerted if there were conditions that we were concerned about with the patient. We have a Microsoft Surface that we load our software on. We call it CHAMP. We decided we wanted to use a modern app with Windows 10 as the operating system.
We would log all of his vitals, and that app became this seamless piece to his care.
With the daily reports that come in from the Azure cloud, if anything is an outlier that needs to be notified to us immediately, it'll alert us.
The tablet already has a camera, and we said, why not get video every day in addition to all the other measurements and just see what that does?
One of the things that saved Winston's life was the 15-second video.
When we were looking at his information, he had a couple days of not gaining weight. He was breathing a little bit harder, and he just wasn't happy on his video.
They could pull it from when he was doing fine and saying, okay, a couple weeks ago, this is what he looked like. Now he looks like this. We think it is part of his aorta.
They did the procedure the next day, and then I think he went home the day after.
There's still that underlying piece in the back of your mind. You're going, this is major heart surgery.
I mean, it's a scary thing to think of what could have happened.
This technology literally saved his life.
The first time that I heard a child's life had been saved with CHAMP, I left the room because I kind of needed to tear up in private because it was a dream that I'd had for a long, long time.
We've learned so much, and it's changed our practice and made us more efficient, but also saved lives, that we want to roll out nationally to other children's hospitals that do cardiac surgery.
For everyone behind the scenes, we're very thankful for it. Saved his life, and how do you say thank you for that?
It's an amazing thing that digital technology is saving lives, and the amazing thing about that hospital is since they've implemented that system, no other baby has lost their life using that technology, and that's really the power of digital, and really baking this into every part of the process in your own hospitals and in your own organizations to do that. It's truly what inspires me to be passionate about healthcare and why I love being in technology and being in healthcare, like I'm sure many of you. It's a greater purpose that it's very great to be part of. So last, I want to show you something very cool. I wanted to introduce HoloLens at HMA 2016. Last year I spoke about it. Last year I showed you a video of it, and this year we decided to bring it here so that you could all come and play with it. I wanted to introduce Dr. Ravi up on stage. They made a little video in the HMA spirit of what we do. And they went around yesterday, last night at the cocktail dinner, and walked around with the HoloLens and put a whole bunch of augmented reality pieces up in the room, all over the room. You may not have seen them, but Ravi walking around certainly would have. One of the things that we're very excited about is the opportunity for visualization in advanced diagnostics in healthcare. And I want to let Dr. Ravi quickly speak about how he sees this innovation. Dr. Ravi is from a company called Vital. They specialize in very, very advanced visualization of diagnostics. So Ravi, over to you.
Thank you, Gabe. In the true spirit of partnership between Vital Images and Microsoft, we're very proud to actually test this device. For the first time, it's available outside of the US market. It's an augmented reality device. It's not virtual reality that actually blocks your space in front of you. I can use my hands, and as a clinician, I can use my hands to do various things, including typing, doing operations, and various other things. In terms of clinical applicability, the different things that we have thought about that this device could be used, as you can see from the screen there, is to actually bring in Microsoft Skype for HoloLens into the environment of the clinical domain and use it for multidisciplinary team meetings. For example, in terms of endoscopy that you can see there, or virtual colonoscopy, and actually identify lesions and bring that out to different clinicians. So you can use that for teleradiology, you can use that for education, and crucially, you can use this for personalized health, right? So this can be a device that I can walk around at home, and if I'm in rehabilitation, I can use this device with lots of gadgets around you. It's the future, and I'm very excited about it.
Right. Thank you, Dr. Ravi. I think it's an amazing opportunity in diagnostic space to be able to do this stuff, and I encourage you to come and have a play with it at our booth later on. Thank you, Ravi. All right, so just to close, at Microsoft, we care deeply about healthcare, and we want to make sure that we work with the thousands of partners around the world that use our technology to drive innovation. If you have innovation projects that you want to work on, we'd be delighted to be part of that and make those things happen. So I encourage you to reach out with our team and have those discussions, because this is really what drives us, and we want to be the ones that can help you make the difference. Thank you very much, and have a great rest of HMA.
Thank you very much for that. Are there any short questions, bearing in mind that we have overrun by about 10 minutes, maybe a couple of minutes for questions? Anybody? No. Yes, one right there.
Very quick questions. Actually, one question for my hospital and one question for myself. First question is, your presentation is very exciting, and a bit scary. It's a way that seems okay. I combine with the previous presentation as well. I say patient is now more approach on the technology, and seem they understand more. Okay, they can Google, they can do everything. They even can they show a live stream and post it to Facebook and to YouTube. So it's quite risky and a lot more riskier, doing business. So in terms of technology, question is, should we continue, business as that's what we are doing today? So the second, for my daughter, actually she going to university. Seems based on your presentation, I should not encourage her to go to the medical school, but instead, go to IT school is a better future, right?
Yeah, so to answer question one, I think there's always going to be a need for hospitals. This is not about replacing hospitals. This is really about integrating the care continuum and using data to make things a lot easier and to also provide better insights and decisions. So this is about, just like HoloLens is about augmenting virtual reality onto the physical world, really what technology is going to do for healthcare is augment a whole lot of extra capability for clinicians and nurses and so forth, and to take the repetitive processes out of healthcare that waste people's time. With regards to your daughter, I think a double degree of medicine and technology is probably very appropriate. And I know many doctors in this room have a love of technology as well, and they've found a passion in themselves while also practicing. So I think that can absolutely happen. Cool.
Any more questions? No? Good. If not, it leads me to thank our speaker in the usual fashion. Thank you very much for your kind attendance.